So our next speaker is Professor Mohammed Shafik. He will be talking about what is new in dry eye disease diagnosis and management. I want to just take a minute to if you want to send questions, just use the app. So the Adore app on your phone. The questions will come here because we'll after Professor Shafik talk, we'll have a discussion. So feel free to send the questions. Professor Shafik is a professor of ophthalmology and cornea and refractive surgery consultant at the University of Alexandria in Egypt. He's currently the president of the Egyptian Society of Keratoconus and Cornea Transplant and an elected board member of the Egyptian Society of Ophthalmology. He's the founder and director of Horus Vision Correction Center in Alexandria. He authored more than 60 original articles and book chapters in the field of cornea and refractive surgery. He's a member of the reviewer board of many of the leading refractive surgery peer-reviewed journals, including Cataract and Refractive Surgery Today. Moreover, he's the global ambassador of the TFOS, the Tear Film and Ocular Surface Society, which make him the perfect person to be talking about dry eye disease. Thank you, Professor Shafik, for being with us today.
Thank you very much, Dr. Shuel, for the nice introduction. Sabah al-khair, good morning, everybody. Very glad to be with you here in Adore for the second time in the cornea and refractive surgery meeting. And this is the first Adore and a nice photo from the first Adore. Thank you, Dr. Ahmed Al-Saadi and Dr. Murad Al-Awathani for the nice invitation and the kind invitation. I feel always like at home when I am in Emirates. And this is my financial disclosure. Actually, it's very hard to speak about the treatment in 9 minutes, but they told me try to speak about the new things in the diagnosis and treatment. So Dr. Masakri revised the definition, and I think the new thing is the definition, because TFOS revolutionized our way of thinking of the dry eye disease as a multifactorial loss of hemostasis, and you should emphasize on the inflammation, damage of the ocular surface, and the neurosensory abnormality. From here, we kick off to the diagnosis, and the most important thing is the diagnosis is the good questionnaire. And the new thing that we have it in Arabic, I use the DQ5 in Arabic. It's very helpful. 5 questions, but it will orient yourself towards the symptoms that the patient's suffering. And then the dry eye testing now, the new things that we can speak a common language. We have a multitude of examinations, and my previous colleague have summed up how to diagnose it. But now, with the fancy machines that they are not any more fancy, which are the ocular surface analyzers, we can speak a common language. Your technician can do with a user-friendly kind of machines a lot of things, the NIBUDs and non-invasive tear breakup time to lead you to the tear film instability, the tear volume, which is the meniscometry, which is the height of the tear lake or lacrimal lake, the interferometry, which guides you to the thickness of the lipid layer, and the meibomian glands, which is very important and crucial to be examined, the shortening, tortuosity, and the drop of the meibomian gland. Not only that, but also the blinking. It can assist the blinking time. And believe it or not, when you analyze the blinking, we can find a lot of abnormal blinking habits that especially link it to the new era of the lifestyle and the screen life. And you can teach your patient, it's new again, you can teach your patient how to do blinking exercise. Even if you go to the smartphones, there are now applications for that. And this is very helpful, by the way, especially for the youngsters and children who are suffering from the dry eye. We see a lot of them. At the end of the examination, we can find such a very nice report. It's very teaching to both the patient and the doctor itself, because it can orient us, where are we? The osmolarity, Dr. Masakri mentioned a lot about osmolarity, but the new thing that we have a very simple osmolarity testing in our offices with, it's by the way, not expensive at all, and it's easier than the Tear Lab one that I showed before. This is also new. And also what's new is you can assess the inflammation by many tests, also an office-based one, and the most important of which is the Inflammadry, which measures the MMP9. This helps you to situate where are you exactly? Is it in the part of the hyperosmolarity or inflammation or the apoptosis or the meibomian gland, which is the above circle, or all of them? And also, where are you in the spectrum? Is it an evaporative one or is it a secretory deficiency one? And again, Dr. Masakri mentioned that the majority of the patients are a mix of both. So it can lead you to what we have now. The real practice now is an oriented therapy one. You can orient your therapy to the lipid layer or to the aqueous layer or to the mucus layer, which is new, and I'm going to show it to you, or to the epithelial layer, which is also new, the epithelial layer damage. So we are bombarded with a lot of fancy machines to treat the meibomian gland dysfunction, and the mainstay of them is to heat, to clean, to express the meibomian gland. And I'm still using the old machines, which is a blefasteam to heat the gland, and the blefex to clean the lipofilm, and then I express them with the forceps. All of them can do. I mean, these are all the tools to clean or to improve the function of the meibomian gland. And again, the fancy, the IPLs, and we have now a multitude of IPLs, and if you can do an IPL after cleaning the meibomian gland, you will get a marvelous result. What's new is the Tervaya. Tervaya is varilinkin, and it is a nasal spray, and it is a secretagogue. It is a parasympathetic agonist. It was used to quit smoking because it's a nicotinic action, but they discovered that through an inhalation of it, by a nasal spray, it got last year the FDA approval, and you can apply it twice per day, and it's a true secretagogue. What's new also are the multitude of anti-inflammatory therapies that we have recently in the past decade, not only corticosteroids because of its multitude of complications, but we have a list of new anti-inflammatories. All of them can do if you know the exact marker that you are treating, and I'm going to show this right now. What's really new is that now we have a mucin topical secretagogue. We have two of them, the ribampid, 2%, and the diclofasol from Santen. And they stimulate the mucus secretion because we had no treatment for the mucus dysfunction before, and they can stimulate the goblet cell. They were used for the peptic ulcers at the beginning to stimulate the mucus from the stomach, and they discovered that they can improve the mucus in the tear film component. And the PRP is a marvelous tool. If you can do or know how to use it properly, you can prepare it easily. It has the full range of the growth factors, and you can use the PRP by all means. By all means, you can use it in eye drops. I inject it intralacrimal in the lacrimal gland in the Sjögren syndrome, or in the inferior fornix subconjunctivally. Our last paper a couple of years ago, by injecting it in the lacrimal gland in the Sjögren syndrome, had showed perfect results in relation to all parameters of the tear film, the Nebo time, the secretion, the meniscus height, and all parameters. And lastly, the biomarkers. In the next few years, we will have this breakthrough. The group of Roy Chetty in India are doing a marvelous job. Biomarkers are being used and revolutionized all the medical diagnosis and treatment. And nowadays, you will incorporate in few years these kits to examine the biomarkers in the tear film. And if you find the exact markers that you are going to address it, you go and address it with a special anti-inflammatory. You will search for the interleukin-6 or the MMP9 or the interleukin-17 or many things else. And they will revolutionize our way of thinking and treating not only dry eye disease, but the keratoconus, retinal disease, and I think the Roy Chetty will introduce it to the market maybe next year. And what's really new also is our new report, the TIFOS new report, that will be published this year, and it will be under the title, The Lifestyle Pandemic Ocular Surface Disease. Because now we know that it is linked to every single detail of our new life. The digital environment, the contact lens wear, the cosmetics, the elective medications and procedures, our nutrition. You're always asked by your patients, the nutrition is helping or not? What about my lifetime and screen time? what about the environmental factors, and we will have an answer for every single point in an evidence-based manner. And lucky enough, I am a member of the Public Awareness Committee that is commissioned to propagate the knowledge in our area, and I will have this honor starting from next year when will allow us to publish that. And I thank you very much for your attention.
Thank you, Professor Shafik.